And welcome back. Time for this week's Capitol Report with Pat McGuigan of CapitolBeatOK.com. Pat, in the healthcare arena, there's a lot of news about turmoil these days, but you have a piece of good news here in Oklahoma County. Tell us about that.
It's building on stories we've had in the past. The Oklahoma County government authorized back in February, and beginning in March, the county government implemented a program for county government employees, allowing them to use the option of using the Surgery Center of Oklahoma for a large cluster of recurring kinds of common procedures. And the thing to remember is that surgery centers' costs are significantly lower than most of the big box hospitals. Well, some additional data is in. We've reported previously on how it's saving money. Here's some additional information. A total of 89 procedures have cost a total of $335,885. That compares to estimates they would have cost $910,700. So there's a savings to taxpayers of $573,814.32.
Thanks for doing the math.
Yeah. Here's what even multiplies this. You have the consumer, not just taxpayers, which is important enough, but you have the consumers, in this case, the recipients of the services, the employees, also have to be happy, because John Wilkerson, who runs the county benefits program, estimates that the employees have saved $267,000 in out-of-pocket expenses. I mean, this is a home run. Now, Surgery Center has become known, and Dr. Keith Smith and his colleagues have become known for the work they're doing. They post online the upfront costs, if you will, of 112 procedures. The typical bill from the Surgery Center is 1 page versus a 3 or 4 page bill that's complex at the larger hospitals. This is good news for the taxpayers, and like I said, for the consumers of healthcare services in this case.
Well, that's good news. Maybe bigger news this past week, though, has been the legal confrontation over the different rulings on the Affordable Care Act. Our Attorney General Scott Pruitt's right in the middle of it.
He is. The appeals court in D.C. ruled that opponents of the ACA and of the way the federal exchanges are operating have, and this is a quote, the better of the argument. They interpreted what they said is the clear language of the federal statute, which says that you cannot you cannot require the subsidies, provision of the subsidies for premiums in states that have not created their own health exchange system, but are using the federal exchange. And indeed, if you look at the language of the statute, that appears to be correct. This is huge. There is a split because there's another circuit that ruled differently. I talked to Attorney General Pruitt. He said this is consequential and that he hopes it's persuasive to the Supreme Court when they eventually consider it. Stay tuned. It is big.
And that's the thing, that will the Supreme Court consider it?
They'll probably consolidate those. I'd be shocked if they don't.
All right. You can read more about these and other stories at CapitolBeatOK.com. For Pat McGuigan, I'm Alex Cameron. Have a great day.